1. A nurse is administering morphine to a postoperative patient. What is the most important observation to make before administration? 1. Blood pressure. 2. Respiratory rate. 3. Heart rate. Answer: respiratory rate. Explanation: morphine is an opioid that can cause respiratory depression, so the nurse must assess the respiratory rate before administration to prevent potential respiratory complications. 2. A patient on warfarin reports eating a large amount of spinach. What is the nurse's priority action? 1. Administer vitamin K. 2. Monitor for bleeding. 3. Call the healthcare provider. Answer: monitor for bleeding. Explanation: spinach is high in vitamin K, which can counteract the anticoagulant effect of warfarin. The nurse should monitor for signs of bleeding and consult the healthcare provider. 3. A patient is prescribed furosemide for heart failure. What is the nurse's priority action? 1. Check potassium levels. 2. Assess blood pressure. 3. Check renal function. Answer: check potassium levels. Explanation: furosemide is a loop diuretic that can cause potassium depletion, so the nurse must monitor potassium levels to prevent hypokalemia and its complications. 4. A patient on lithium therapy is experiencing tremors, confusion, and ataxia. What is the most likely cause? 1. Overdose. 2. Dehydration. 3. Infection. Answer: overdose. Explanation: symptoms of tremors, confusion, and ataxia in a patient on lithium therapy are indicative of lithium toxicity, which can occur due to overdose or dehydration. 5. A patient on ACE inhibitors is at risk for which of the following adverse effects? 1. Hyperkalemia. 2. Hypokalemia. 3. Hypoglycemia. Answer: hyperkalemia. Explanation: ACE inhibitors can decrease aldosterone production, leading to potassium retention and a risk of hyperkalemia, especially in patients with kidney dysfunction. 6. A nurse is administering digoxin to a patient with heart failure. What must the nurse assess before administration? 1. Blood glucose. 2. Potassium levels. 3. Respiratory rate. Answer: potassium levels. Explanation: digoxin toxicity is more likely to occur in the presence of hypokalemia. Therefore, the nurse must monitor potassium levels before administering digoxin. 7. A patient is prescribed atorvastatin for hyperlipidemia. What is a common side effect that the nurse should monitor for? 1. Jaundice. 2. Muscle pain. 3. Headache. Answer: muscle pain. Explanation: statins like atorvastatin can cause muscle pain or weakness as a side effect, and in severe cases, it can lead to rhabdomyolysis. 8. A nurse is caring for a patient receiving heparin therapy. Which of the following laboratory results should be monitored to assess for a potential complication? 1. Hemoglobin. 2. Platelet count. 3. Prothrombin time. Answer: platelet count. Explanation: heparin therapy can cause heparin-induced thrombocytopenia, HIT, which leads to a decrease in platelet count and an increased risk of clot formation. 9. A nurse is administering ceftriaxone to a patient with an infection. What is a potential side effect the nurse should be aware of? 1. Diarrhea. 2. Tachycardia. 3. Hyperglycemia. Answer: diarrhea. Explanation: ceftriaxone, like other antibiotics, can disrupt the normal gut flora and lead to diarrhea, including Clostridium difficile-associated diarrhea. 10. A patient with asthma is prescribed albuterol inhaler. Which of the following is a common side effect? 1. Tachycardia. 2. Bradycardia. 3. Hypotension. Answer: tachycardia. Explanation: albuterol is a beta-2 agonist that can stimulate the heart and cause tachycardia as a common side effect. 11. A patient is prescribed metformin for type 2 diabetes. What is the nurse's priority teaching point for the patient? 1. Take with meals to reduce gastrointestinal upset. 2. Monitor blood pressure daily. 3. Increase fluid intake to prevent dehydration. Answer: take with meals to reduce gastrointestinal upset. Explanation: metformin can cause gastrointestinal side effects like nausea, so it is recommended to take it with meals to minimize these effects. 12. A nurse is caring for a patient who is receiving warfarin therapy. Which of the following should be avoided to prevent interactions? 1. Garlic. 2. Potatoes 3. Apples answer, garlic. Explanation: garlic can increase the anticoagulant effect of warfarin, leading to an increased risk of bleeding. 13. A patient is being discharged with a prescription for tramadol. What is the nurse's primary concern regarding this medication? 1. Risk of sedation 2. Risk of constipation 3. Risk of dependency answer, risk of sedation. Explanation: tramadol is an opioid analgesic that can cause sedation and respiratory depression, especially when combined with other CNS depressants. 14. A patient is prescribed ciprofloxacin for a urinary tract infection. Which of the following should the nurse educate the patient about? 1. Avoid direct sunlight 2. Increase potassium intake 3. Take the medication with antacids answer, avoid direct sunlight. Explanation: ciprofloxacin is a fluoroquinolone that can cause photosensitivity, so patients should avoid direct sunlight and wear sunscreen. 15. A nurse is administering vancomycin to a patient. What is the most important nursing action? 1. Monitor blood pressure 2. Check renal function 3. Monitor respiratory rate answer, check renal function. Explanation: vancomycin can cause nephrotoxicity, so it is important to monitor renal function during therapy to prevent kidney damage. 16. A patient is receiving intravenous potassium replacement. What should the nurse do to minimize the risk of adverse effects? 1. Administer the infusion rapidly 2. Monitor the patient for signs of infiltration 3. Administer the potassium on an empty stomach answer, monitor the patient for signs of infiltration. Explanation: potassium infusions should be administered slowly to prevent irritation and infiltration, which can cause severe tissue damage. 17. A patient receiving a blood transfusion starts to experience chills, fever, and anxiety. What is the nurse's first action? 1. Stop the transfusion 2. Administer an antihistamine 3. Notify the healthcare provider answer, stop the transfusion. Explanation: the patient is experiencing symptoms of a transfusion reaction. The first action is to stop the transfusion to prevent further complications and then assess the patient. 18. A nurse is caring for a patient who has been prescribed a selective serotonin reuptake inhibitor, SSRI, for depression. What is a potential side effect to monitor for? 1. Serotonin syndrome 2. Weight gain 3. Tachycardia answer, serotonin syndrome. Explanation: SSRIs increase serotonin levels and can lead to serotonin syndrome, which is characterized by symptoms such as agitation, confusion, and hyperreflexia. 19. A nurse is administering an intravenous 4. dose of lorazepam. What is the most important action to take during the administration? 1. Administer slowly to prevent hypotension 2. Monitor blood glucose levels 3. Administer with food to reduce gastrointestinal irritation answer, administer slowly to prevent hypotension. Explanation: lorazepam can cause hypotension, especially with rapid infusion, so it should be administered slowly to minimize this risk. 20. A patient is receiving hydrocodone for pain management. What should the nurse monitor for as a potential side effect? 1. Bradycardia 2. Respiratory depression 3. Hypertension answer, respiratory depression. Explanation: hydrocodone is an opioid that can cause respiratory depression, a potentially life-threatening side effect. 21. A patient is being treated with an inhaled corticosteroid for asthma. What is the nurse's priority teaching point? 1. Rinse mouth after use 2. Take the medication on an empty stomach 3. Avoid any physical activity after use answer, rinse mouth after use. Explanation: inhaled corticosteroids can cause oral thrush, so the patient should rinse their mouth after each use to reduce the risk of fungal infections. 22. A patient who is receiving antiplatelet therapy is at risk for which of the following complications? 1. Stroke 2. Bleeding 3. Hypertension answer, bleeding. Explanation: antiplatelet drugs prevent clot formation, which increases the risk of bleeding. Monitoring for signs of bleeding is critical. 23. A nurse is caring for a patient with chronic kidney disease, CKD, who is taking ACE inhibitors. What is the most important side effect to monitor for? 1. Hyperkalemia. 2. Hypoglycemia. 3. Weight gain. Answer: hyperkalemia. Explanation: ACE inhibitors can cause hyperkalemia, especially in patients with CKD, as they reduce aldosterone secretion, leading to potassium retention. 24. A nurse is administering a chemotherapy drug. What is the priority action to prevent infection in a patient receiving chemotherapy? 1. Administering growth factors. 2. Encouraging good hand hygiene. 3. Monitoring electrolyte levels. Answer: encouraging good hand hygiene. Explanation: chemotherapy can suppress the immune system, increasing the risk of infection. Proper hand hygiene is crucial to prevent infections. 25. A patient is prescribed baclofen for muscle spasms. What is a potential side effect to monitor for? 1. Hypotension. 2. Drowsiness. 3. Nausea. Answer: drowsiness. Explanation: baclofen is a muscle relaxant that can cause drowsiness as a common side effect, which may affect the patient's ability to perform daily activities safely. 26. A nurse is preparing to administer acetaminophen to a patient with mild pain. What is the most important assessment prior to administration? 1. Liver function. 2. Kidney function. 3. Blood pressure. Answer: liver function. Explanation: acetaminophen is metabolized in the liver. Patients with impaired liver function are at risk for hepatotoxicity, so liver function should be assessed before administration. 27. A patient is prescribed prednisone for an autoimmune disorder. What is a potential side effect that the nurse should educate the patient about? 1. Weight loss. 2. Increased appetite. 3. Hypoglycemia. Answer: increased appetite. Explanation: prednisone, a corticosteroid, can cause increased appetite, fluid retention, and weight gain as common side effects. 28. A nurse is caring for a patient who is prescribed nitroglycerin for chest pain. What should the nurse monitor for as a potential side effect? 1. Hypotension. 2. Hypertension. 3. Tachycardia. Answer: hypotension. Explanation: nitroglycerin is a vasodilator that can cause a significant decrease in blood pressure. The nurse should monitor for hypotension, especially when the patient changes positions. 29. A patient who is receiving chemotherapy develops mouth sores. What medication should the nurse expect to be prescribed to manage this side effect? 1. Antifungal. 2. Analgesic. 3. Antiemetic. Answer: analgesic. Explanation: mouth sores, mucositis, are a common side effect of chemotherapy, and an analgesic may be prescribed to manage pain associated with these sores. 30. A nurse is administering a dose of enoxaparin to a patient. What is the priority action to assess before administration? 1. Platelet count. 2. Creatinine clearance. 3. Blood pressure. Answer: platelet count. Explanation: enoxaparin is a low molecular weight heparin, which can cause thrombocytopenia. Monitoring platelet count is essential to detect heparin-induced thrombocytopenia (HIT). 31. A patient is prescribed hydralazine for hypertension. Which of the following is a common side effect to monitor for? 1. Dizziness. 2. Tachycardia. 3. Edema. Answer: dizziness. Explanation: hydralazine is a vasodilator that can cause dizziness, especially when standing up quickly, due to orthostatic hypotension. 32. A patient is prescribed amlodipine for hypertension. What should the nurse monitor for as a side effect? 1. Constipation. 2. Peripheral edema. 3. Weight loss. Answer: peripheral edema. Explanation: amlodipine is a calcium channel blocker that can cause peripheral edema, particularly in the lower extremities, as a common side effect. 33. A nurse is preparing to administer a dose of dantrolene to a patient diagnosed with malignant hyperthermia. What is the nurse's priority action? 1. Assess the patient's liver function. 2. Monitor the patient's temperature. 3. Assess blood pressure. Answer: monitor the patient's temperature. Explanation: dantrolene is used to treat malignant hyperthermia by reducing muscle rigidity and hyperthermia. Monitoring the patient's temperature is crucial for assessing the effectiveness of treatment. 34. A patient is being treated for tuberculosis with rifampin. What side effect should the nurse educate the patient about? 1. Urine discoloration. 2. Weight gain. 3. Tachycardia. Answer: urine discoloration. Explanation: rifampin can cause orange or red discoloration of bodily fluids, including urine, sweat, and tears, which is harmless but should be communicated to the patient. 35. A nurse is administering lisinopril to a patient. What is the most serious side effect to monitor for? 1. Hyperkalemia. 2. Hypoglycemia. 3. Weight gain. Answer: hyperkalemia. Explanation: lisinopril, an ACE inhibitor, can increase potassium levels and lead to hyperkalemia, which can be life-threatening. 36. A patient is prescribed tramadol for moderate pain relief. What is a common side effect of this medication? 1. Sedation. 2. Diarrhea. 3. Hyperactivity. Answer: sedation. Explanation: tramadol, a synthetic opioid, can cause sedation and drowsiness as a common side effect, which can impair the patient's ability to perform daily activities safely. 37. A nurse is administering warfarin to a patient. What dietary considerations should the nurse discuss with the patient? 1. Avoid foods rich in vitamin C. 2. Increase intake of leafy green vegetables. 3. Limit intake of foods high in sodium. Answer: avoid foods rich in vitamin C. Explanation: while warfarin interacts with vitamin K, excessive vitamin C intake can increase the risk of bleeding, so the nurse should educate the patient to avoid large quantities of vitamin C-rich foods. 38. A patient is prescribed valproic acid for epilepsy. What is a potential side effect that the nurse should monitor for? 1. Hepatotoxicity. 2. Hypotension. 3. Bradycardia. Answer: hepatotoxicity. Explanation: valproic acid can cause liver toxicity, especially in young children, so liver function tests should be monitored regularly. 39. A patient is prescribed metoprolol for hypertension. What is the nurse's priority assessment before administration? 1. Blood pressure. 2. Respiratory rate. 3. Blood glucose. Answer: blood pressure. Explanation: metoprolol is a beta blocker, and it is important to assess blood pressure before administering to ensure that it is not too low. 40. A nurse is caring for a patient on opioid therapy for chronic pain. What is a major concern for this patient? 1. Constipation. 2. Diarrhea. 3. Tachycardia. Answer: constipation. Explanation: opioid therapy is a common cause of constipation due to its slowing effect on the gastrointestinal system. Nurses should monitor for this side effect and educate the patient on prevention strategies. 41. A nurse is preparing to administer a dose of furosemide to a patient. What is a priority assessment before administering the medication? 1. Potassium level. 2. Oxygen saturation. 3. Urine output. Answer: potassium level. Explanation: furosemide is a loop diuretic that can cause potassium depletion, so it is essential to check potassium levels before administration. 42. A patient is receiving an infusion of morphine for pain management. What is the most important observation the nurse should make during administration? 1. Heart rate. 2. Respiratory rate. 3. Temperature. Answer: respiratory rate. Explanation: morphine, an opioid, can cause respiratory depression. It is crucial to monitor the respiratory rate to prevent hypoventilation. 43. A nurse is administering a dose of potassium chloride to a patient. What is the most important action to take? 1. Administer with food. 2. Dilute the solution. 3. Administer rapidly. Answer: dilute the solution. Explanation: potassium chloride should be diluted to prevent irritation to the veins and avoid cardiac arrhythmias caused by a concentrated dose. 44. A patient is prescribed clindamycin for an infection. What should the nurse educate the patient about regarding gastrointestinal side effects? 1. Take with food to avoid nausea. 2. Avoid dairy products to enhance absorption. 3. Report severe diarrhea to the healthcare provider. Answer: report severe diarrhea to the healthcare provider. Explanation: clindamycin can cause severe diarrhea, including Clostridium difficile-associated diarrhea, which should be reported to the healthcare provider immediately. 45. A patient is prescribed hydrochlorothiazide for hypertension. What is a potential side effect that should be monitored? 1. Hyperkalemia. 2. Hypokalemia 3. Hypoglycemia. Answer: hypokalemia. Explanation: hydrochlorothiazide is a thiazide diuretic that can lead to potassium loss and cause hypokalemia, requiring monitoring of potassium levels. 46. A nurse is caring for a patient receiving potassium-sparing diuretics. What is the most important consideration when administering this medication? 1. Monitor for hyperkalemia. 2. Monitor for hypoglycemia. 3. Monitor for fluid retention. Answer: monitor for hyperkalemia. Explanation: potassium-sparing diuretics can cause potassium retention, increasing the risk for hyperkalemia. The nurse should monitor the patient's potassium levels. 47. A patient is prescribed clopidogrel for a recent myocardial infarction. What is the most important teaching point for the nurse to provide? 1. Avoid grapefruit juice. 2. Take with food to reduce gastrointestinal upset. 3. Monitor blood pressure regularly. Answer: avoid grapefruit juice. Explanation: grapefruit juice can interact with clopidogrel and increase its effects, leading to an increased risk of bleeding. 48. A patient is prescribed lisinopril for hypertension. What is a potential adverse effect the nurse should educate the patient about? 1. Cough. 2. Constipation. 3. Weight loss. Answer: cough. Explanation: ACE inhibitors like lisinopril can cause a persistent dry cough as a common side effect due to increased bradykinin levels. 49. A patient is prescribed metronidazole for an infection. What is an important side effect to educate the patient about? 1. Metallic taste. 2. Diarrhea. 3. Increased appetite. Answer: metallic taste. Explanation: metronidazole is known to cause a metallic taste in the mouth, which can be unpleasant but is not harmful. 50. A nurse is administering a dose of digoxin to a patient. What is a priority action prior to administration? 1. Check heart rate. 2. Monitor blood pressure. 3. Check kidney function. Answer: check heart rate. Explanation: digoxin can cause bradycardia, so it is important to check the patient's heart rate before administration to ensure it is within a safe range.